What causes painful intercourse with interstitial cystitis? If you or someone you know experiences pain during sex and has interstitial cystitis, also called bladder pain syndrome, you might wonder what's causing it. The main reason often isn't just bladder pain itself but involves the muscles around the pelvis. These pelvic floor muscles support the bladder and help control sexual functions like arousal, penetration, and orgasm. In interstitial cystitis, these muscles can become tight, strained, or irritated, forming knots or trigger points. These muscle issues can cause significant pain during and even days after intercourse. In women, because the bladder and vagina are close together, mechanical irritation during vaginal sex can worsen discomfort. When the pelvic muscles are tense or inflamed, they can press against the bladder or irritate surrounding nerves, making penetration painful. The shared nerve supply between the bladder and pelvic muscles explains why bladder symptoms and pelvic pain often go hand in hand. This overlap can make sex uncomfortable and sometimes even painful. Pain during sex in interstitial cystitis can also include decreased desire, difficulty reaching orgasm, and insufficient lubrication. These symptoms can lead to emotional stress, anxiety, and depression, which might make the pain worse. It's important to understand that these issues are complex and involve both physical and emotional factors. Beyond muscle dysfunction, bladder inflammation and issues with the bladder lining can contribute. The bladder lining may become overly sensitive or damaged, leading to increased pain signals. Mast cell activation and autoimmune responses might also play a role, but these are less directly related to the pain experienced during sex. When the bladder is inflamed or sensitive, sexual activity can trigger flare-ups, causing prolonged discomfort afterward. Managing painful intercourse with interstitial cystitis often involves a combination of approaches. Pelvic floor physical therapy can help relax and strengthen the muscles, reducing tension. Using lubricants during sex can minimize friction and irritation. Planning intimacy during times when symptoms are less active can also help. Some people find relief through treatments targeting bladder symptoms, such as bladder installations, medications, or nerve blocks. Open communication with partners and healthcare providers is key to addressing both physical and emotional aspects of sexual pain. In summary, the primary causes of painful intercourse in interstitial cystitis are related to pelvic floor muscle dysfunction and mechanical irritation from the close relationship between the bladder and pelvic structures. These issues are compounded by bladder inflammation and heightened sensitivity. Addressing both muscle health and bladder symptoms can help improve comfort and quality of life. Always consult a healthcare professional for personalized advice and treatment options tailored to individual needs.